Well, first of all, to be nice to people who's got pain, because you don't want to have pain and you can't help yourself, and nobody wants to live with pain. And secondly, talk to you, try to explain to you what is actually happening to your body, the reason why you're having pains, and what you can do to help yourself. It's very, very important, because with that now, you don't have all this worry, because when you're in pain, you do worry. And when you worry, it aggravates the pain more. So they should try to be very, human, put it that way. Yeah.
I suppose the first thing I will advise a GP listening to somebody with consistent pain is to not to dismiss that this person's pain is real. The pain is real, it is there. It's not just moaning or whinging about something, it's just there. And most people that suffer from pain don't want to have it. It's not about, getting a day off school or a day off work. It's about living with this constant thing that's, even if you try to forget about it, it comes back. I also would say, don't underestimate the fear that the person will have of recurring pain.
Obviously listen and try some of the other alternatives, but I think ultimately is getting people to manage their pain, to understand their medication, to go through all of the ramifications of what Calm does present, because it is holistic. It helps you to understand your medication and take control of that, to the point where I became medication free. I still have it there if I think I'm having a flare up or if I recognise I'm going to trigger, but I manage that. I pace so much that I avoid triggers and having to take medication. So the advice I would give is, really listen, and if people are talking about or describing chronic pain, long-term pain and so on, send them to the professionals, send them to the experts and help them to become an expert, because that's what's needed really.